But you know, there was a time and place when we didn't have seatbelts in our cars. And I was remembering that the other day. You know, nobody had seatbelts. You just got in the car, you took off. And some of the folks here from the congressional staff remember that. And then they came out with a lap seatbelt, where they said you had to wear your lap seatbelt would save lives. Later on, they added the shoulder strap to that, and now we know we get a big fine, a big ticket, a $250 ticket for not wearing your seatbelt. Then they added the airbags to cars, and it was the federal government that mandated those changes with the automakers. It saved lives, and it proves to save lives, and we should do the same thing with healthcare. We should do the same thing with preventative measures and with early testing. Prevention and early health care are critical elements in improving the quality of lives for all of us. Reforms should drive incentives for prevention and early detection. Screenings like HIV testing should be mandatory. HIV testing should be done not only if we're looking at a public option, and God willing there will be one day, but through all medical insurance programs. If we start testing early, can you imagine the amount of money we'd be saving and the lives, the quality of lives that we would be improving for all of Americans. CDC stated recently that prevention and wellness should be a top national priority. We need to work together to transform our sick care. To succeed in a health promotion and disease prevention, we need to create an environmental change so that appropriate behavior is seen as normative behavior, which means changing the environment in which people actually live, work, and play. Focus on behaviors by teaching people how to take proper steps to good, healthy living. I'm looking at HIV/AIDS. I have a former board member by the name of Reese, who's been living with the epidemic now for 25 years. 25 years, difficult on the system. He lives a fairly good life. But in those 25 years, it costs approximately $1.2 million just to keep him alive. Not to mention some of the side effects that he has from a lot of the medical combinations that are out there. They're very toxic to the system. And when we're looking at, there's an overestimated 21% of those living with HIV nationwide that don't even know their status. We know that in our communities, the Latino communities, the people of color, we sometimes don't find out our status until it's too late, and our immune systems are already compromised. So when we're looking at HIV, whether it be HIV or diabetes, we should be able to have a wraparound early testing and prevention mechanism built into the healthcare plan. And you said it so right, Dr. Zellman, that we cannot wait until the next go-round for discussion on healthcare reform. We need to put into the healthcare reform now all the mechanisms that we think is going to be able to address our community and adequately. And if it is not covered in this year, at least it's in the discussions for the following years, so that we can make changes and modifications to any plan that comes out of Washington, D.C. And finally, I just want to say, because I know this is a very good and hot topic, we really need to be visionaries. We know that early testing and prevention and holistic programs for all of our communities is going to work in the long run and in the short run. We know that the congressional and special interests are afraid to go that far in the near future, but you know, we only have one life to live, and now's our time. And so when I'm asking the congressional representatives that are here in Congress, is to look at including this in the healthcare reform and building upon it, so that in the years to come, once we adopt some kind of reform, that this is at least a base, a foundation that we can build upon.
Looking at the whole spectrum of prevention, where you have your primary prevention being focused on community activities that will even prevent diseases from occurring at all, and contrast that to the secondary prevention, where we're trying to detect disease before they become symptomatic in our patients, or even the tertiary level, where we're aimed at slowing the progress of a disease that's already occurred. So much of the healthcare system right now is focused on that secondary and tertiary level of care, and it's not engaged in that primary level of care, where you can be so much more effective and prevent the costs down the line. In addressing this to just the general community at large, Centers for Disease Control, our own federal watchdog there, is saying that for every dollar spent on water fluoridation, $38 is saved in dental restorative treatment costs. And if you pull that even into prenatal care, as you help women either through fluoridation type programs as they're taking their prenatal supplements, or even chewing a certain type of gum so that bacteria isn't transmitted to the baby. This is all at that primary prevention level, which then helps us prevent costs down the line. For every dollar spent on the Safer Choice program, which is a school-based HIV and STD program and pregnancy prevention program, about $2.65 is saved on medical and social costs. For every dollar spent on preconception care programs for women with diabetes, they can reduce health costs by $5.19 by preventing costly complications in both mothers and babies. These are just some examples of where focusing on that primary prevention level will help us save dollars down the line. It's really critical, and there are providers in this room, from the family practice docs to the FNPs and the physician assistants. We're all engaged in looking at those very simple prevention messages that can be put into place so that we can prevent costs down the line. I am the director of a community clinic. Everything that Gloria said about the challenges that we face are very near and dear to us. We also are looking at the way the reform movement is trying to incorporate some of the preventive aspects, but also moving us to a patient-centered medical home, actually having somebody that a patient can come to and say, gee, I'm just not feeling so well, what might be going on, before an actual symptom is coming out and leading to some kind of costly intervention. Promoting medical homes, patient-centered medical homes, is really a key component of what we need to get into reform.
Very good, thank you.